Coronaviruses are defined as a large family of viruses that cause illness ranging from the common cold to more severe diseases. The time from exposure to onset of symptoms is estimated at 2 to 10 days by WHO and 2 to 14 days by the US Centers for Disease Control and Prevention, or CDC. The signs and symptoms of COVID-19 disease vary, ranging from mild to severe conditions. Manifestations include fever, cough, sore throat, breathing difficulties, and chest discomfort, and even death. Tests involve infectious laboratory, particularly SARS-CoV-2, real-time PCR, obtained from nasopharyngeal and throat swabs to identify viral load. Additional tests such as chest X-ray or CT scan might be required. If infection is confirmed, patients will be individually isolated and treated separately. Negative pressure room and intensive care might be needed in some cases. In fact, people of all ages can be infected by the COVID-19. Older people and people with underlying diseases such as asthma, diabetes, heart diseases, and neurological diseases appear to be more vulnerable to becoming severely ill with the virus. WHO advises people of all ages to take steps to protect themselves from the virus, for example, by following good hand hygiene and good respiratory hygiene. Even though science is racing to develop vaccines to blunt the outbreak's impact, currently there is no specific vaccine to prevent infections against COVID-19 disease. To clarify the myth, influenza vaccines or flu shots are vaccines that only protect against infection caused by influenza viruses, not coronaviruses. Therefore, being vaccinated with influenza vaccines does not help minimizing the risk of COVID-19 infections. Although COVID-19 disease seems to be frightening, in fact, it is self-limiting, especially if individuals' immune system works properly. Recently, there is no definite treatment for COVID-19 disease. Principal treatments involve symptomatic or supportive approaches, based mainly on a wide range of symptoms and complications, such as mild or severe pneumonia, acute kidney injury, and acute respiratory distress syndrome. If severe complications such as sepsis and septic shock present, intensive care in a negative pressure room is highly needed. The current medications that have been used to treat COVID-19 include anti-malarial agents, antiretroviral therapy used in HIV patients, and certain antiviral drugs used to attack flu virus. Maintain at least 1 meter distance between yourself and anyone who is coughing or sneezing. When someone coughs or sneezes, they spray small liquid droplets from their nose or mouth, which may contain virus. If you are too close, you can breathe in the droplets, including the COVID-19 virus, if the person coughing has the disease. Thus, social distancing significantly helps to reduce chances of disease transmission.